So
True.
best wishes.
Thank you. Thank you. So are we all set? And I request all of you, if you have any queries, please feel free to put it in the chat group. So later, towards the end of the webinar, when we are done with the conversation, we'll probably take up the questions and I'll address it to Dr. Renu Kishore and we'll get the answers from her directly. I'll just start in a second. Okay. So we'll start, Dr. Kishore, with basically what is mental health. You know, there is a lot of talking about physical health. We all take care of our physical health. We go for exercise, we take supplements, we take care of our diets. But when it comes to mental health, we are a little, ignorant, or we are not aware of what is mental health. So I would like to know from you, what is mental health, first of all, and why it is, suddenly in these times we are hearing about mental health, the importance of mental health. And especially in these COVID times, in these uncertain times, everybody is talking about, mental health. So what is mental health?
You're absolutely right, Navroop, that this year especially, it has been a very hot topic, and everybody is concerned. Mental health is a very broad topic, and just as physical health is a very large, wide area, if we were to define physical health, we may not be able to do it very properly. So in the case of mental health, it not first of all, I want to tell you that according to the World Health Organization, it is not absence of mental illness. Usually we think, okay, if there is if there is no mental illness, I'm healthy.
Mm. Yes.
But just as if you don't have fever and if you don't have any grave disease, are you healthy? It's the
Mm.
same with mental health, that it is something which refers to a state of well-being, overall well-being. And again, I'm going by the definition of World Health Organization, which has come to be a very encouraging organization towards mental health. It's a state of well-being in which the individual realizes his or her own full potential, whatever you have inside you, whether it is your intelligence or your personality. If you're able to bloom as well as you can, you're mentally healthy. If you can cope with the normal day-to-day stresses of life, you're mentally healthy. And if you can work productively, whatever work, it could be the work of a housewife, you may be a career person, you may be a child going to school, whatever is your area of work, if you're able to be productive in it and carry on smoothly, then it's a sign of mental well-being. And finally, if you're able to make some kind of contribution to your society, to your community, that is also mental well-being. So well-being is a little beyond illness. It means
Mm.
that you are really, blooming and prospering, you're happy. And the characteristics of mentally healthy people are that they have their problems. There is no one in the world who doesn't have problems or who doesn't have highs and lows in moods and in situations. But okay, you be sad one day, you can get angry one day, but then you bounce back. We call
Mm.
it resilience.
Yes.
Resilience. And getting back to normalcy. It's okay to be sad. It's okay to be not okay sometimes.
Mm-hmm.
We all have a right. But a generally mentally healthy person is one who is generally able to live or lead his or her everyday life and is generally happy with life, sees purpose in his or her being, and is actively contributing towards the family, society, and community.
Wonderful, wonderful. So if I have to
Thanks.
sum it up, the goal is not to be flat. The goal is, take life, enjoy what comes in life, be it ups or downs, and how fast we are able to bounce back. And not just that, maintaining the positive state of mind and then contributing
Absolutely.
to the well-being, right? Contributing to the
Absolutely.
well-being of society. Wonderful. That's very, very clear in terms of it's not just the absence of illness, but
Correct.
you have to have a contributory stand as well, and a positive
Absolutely.
state of mind most of the time, right? Okay. Okay. And why? Yeah, you were saying something.
I
Please,
was
please.
just saying that your question was that in today's world with the pandemic, it has affected worldwide each and every person.
Mm,
I can hardly think of anybody who's not affected. And
true.
along with the physical changes that are coming in our life, which means lockdown, having to wear masks, having to not being able to go out, not being able to meet your friends, working from home, schooling from home, everything. So it's been quite a stressful period. It's been nearly half a year now. And
Mhm,
everybody is now feeling pressured. There is a sense of monotony. Initially, there was a lot of worry, a lot of fear.
mhm,
And now, with the unlocking, the fear element is kind of going down, but there is a sense of stagnation. And
mhm.
also, a lot of domestic issues have cropped up because
Oh,
people are home. So, staying together for so long and not having a chance to meet outsiders, not getting a break from each other. Also, people who are already feeling low, people who are already having some predispositions towards physical illness or some kind of mental weakness, whatever, they do suffer more during these days. And
mm,
as a therapist, I'm getting so many cases these days of young, middle-aged, old, all types, women, men, children, everyone. And they are going into a sense of depression, a
mhm,
sense of hopelessness because there's a lot of uncertainty. They're not able to make plans. Also, there are people, who have gone overboard with their fears. And sometimes, for example, I'll give you an example. Hand washing. How much of hand washing an average person did in 2019 as
mhm,
compared to now? Now we are doing it, we have to do it to save our physical selves. But there are people who are a little obsessive in general, and they were already very, very cleanliness conscious earlier also. So
mhm,
they are going overboard now. So if they were washing their hands 10 times during the day last year, this year it's going up to 30, 40, 50. So, it's everything can get aggravated. Depression can get aggravated. And we have to be constantly on the lookout. We have to be very, very careful, not just for ourselves, but for our immediate family, friends, neighbors, other people who are working for us,
mhm.
everyone. We must be very, very cautious. And that's why mental health today is being talked about a lot.
Right, right, right. So there's a lot of talk about this mental health, and we have to reach out for each other in this pandemic because people are in isolation, there is quarantine and everything. So when one knows that we need a professional help, otherwise, because we say, okay, if you are going through something, if you are troubled, go and talk to someone, go and talk to your family member or someone trustworthy. But where is that line which tells you, oh, now you need a professional help? How do we know
That's a
that?
that's a great question because unfortunately, mental health has come up in a big way. I think only last century or so. Before that, people used to brush it under the carpet. We in India, we would go to astrologers. We'd get our horoscopes read. Even today, in fact, even
Yeah.
amongst very literate people, there is a view that perhaps there is something wrong with the stars, or you'll go to an astrologer and you'll try to find out, or there is some kind of buri nazar, evil eye on you, some kind of a curse. So also, it has been believed that it's only a weak person who gets mental illness. If you're depressed, it's your fault.
Hmm.
If your child is having problem, it's the fault of the parents. You haven't
Yeah.
done
Yeah. We
correct
keep telling
parenting.
Yeah, and he said, think positive. You have so many things, so good things, so many good things in life. Why you are like that? Chal thoda, let's
Exactly,
go out. Yeah,
exactly.
let's go out. Why you are not happy? Think
Yeah,
positive.
why? Exactly.
Yeah,
Just think positive, snap out
yeah.
of it, change your mind. Yeah, it works, of course, to a certain extent. But then sometimes there are some, just like if you have 104 fever, or if you have a very bad disease, something which is really causing a lot of issues, then you have to go to a specialist, right? So similarly here, so what are the warning signs, or what are the tipping points, as we can say? First of all, let me clarify to you that there is no sharp dividing line between normality and abnormality.
Got it.
It's very hard to say, uh, now you are so much depressed, now it's time to go to a professional. It's
Okay.
very hard. But trained psychologists, psychiatrists, and all kind of mental health professionals, we have assessment tools.
Okay.
And the best thing to do, of course, in the beginning, we'll all talk to our elders in the family, friends. Sharing is a very, very good option. But then sometimes there comes a time when you're just not able to deal with it by talking to elders, because counseling is actually not advising. A
Hmm.
lot of people say, I did so and so's counseling today.
Yeah.
They think it's just talking, but
Yeah.
you and I know how much of professionalism there is. We have techniques which people are, they just think you're talking to them. First of all, we are not giving advice. We are
True.
not talking aimlessly. We are using certain schools of thought, certain we have certain ethics. There's confidentiality. So on the whole, of course, it's hard, but we use assessment techniques to find
Hmm.
out if a person really needs help, or just maybe some extra motivation, or just a hug or something more, just some positive strokes. But generally, as a rule of thumb, if you find that the person is not able to deal with his or her own daily life,
Okay.
is withdrawing from society, from family, is not interested anymore in the things that he or she was. If there are very big changes, very extreme changes in one's sleeping and eating patterns, and extreme mood swings, then that is the time when it's definitely advisable to meet a counselor
Mhm.
and take help. Maybe for all you know, there may be nothing. And that is leave it to the professional. They will
Mhm.
let you know. But generally, if you find that it's happening for over a few months, once, if there has been a death in the family, if there has been an earthquake, some natural disaster, something has happened, or like pandemic, a certain amount of issues are understandable. But if they last beyond a certain period, that is where we have classifications, DSM and ICD classifications, and we have properly set parameters. So if the person's behavior is a little beyond that, then sometimes we have to give proper therapy and medicines also sometimes.
Mm-mm. So basically, if a person is behaving in unusual ways, which family and friends can pick up, very
Yes,
easily,
yes,
that he's not his usual self, and something
absolutely.
is changing in him, or something is off, and then they can pick it up, and then that is the time that we need professional help. So that's a very
Very
clear
true.
demarcation. Yeah, very clear demarcation in
Mm-hmm.
that sense. And coming to counselors and psychologists or psychiatrists, whenever I talk to my friends who are not from the field, they're like, "Oh, we are boggled about, whether to go to a psychiatrist, whether to go to a counselor, or psychologist." So, what's the difference for common men? If you can explain to us, what is the difference between a counselor, a psychiatrist, a psychologist, and how do I decide which
Where
one
to
to go to?
go? Hmm.
Yeah.
See, I'm glad you asked this, because a lot of people sometimes see I'm a psychologist, I'm a psychotherapist, I'm a counselor. A lot of times people ask me, ma'am, aap dawai de do, give me medicines. And I say, no, that's not my domain. So first of all, let me tell you that a psychiatrist is one who is a medical person who has done basic medical studies and then specialized in psychiatry, the study of the mind. So that person is an MD. And that person is able to give you medicines, prescribe treatment of various kinds, biochemical treatments. A
Mm-hmm.
psychologist is one who has done basic studies in the science of behavior, emotions, and thinking. And a psychology degree only gives us a general knowledge about psychological motivation and learning and other things, and also basics of abnormal psychology. Then we have counselors. Counseling psychology is again a specialized field where a person who has studied psychology specializes in certain theories of counseling and techniques of counseling. And counselors generally work in the area of, with those people who are so-called normal, who are still functioning. For example, it could be school counseling, can be career counseling,
Mm-hmm.
child counseling, family counseling, okay, relationship counseling, marriage counseling. So they are not unhealthy as such, if you can think about that. Then we have clinical psychologists. Clinical
Mm-hmm.
psychologists have done a specialized degree in assessment of disorders and in psychotherapy, and they usually work in clinical settings and they work with psychiatrists. There's always a teamwork happening. So, then there are, you must have heard the term psychoanalysts, people say, are you going to do hypnosis on us? Are you going to do dream analysis? So that is one type of psychotherapy, which is based on Freudian theory and psychoanalytic psychotherapy. We have cognitive behavior therapy. We have humanistic therapy. So we have various, as I said, there are various techniques. So this is the difference. And then we also have, in some countries, we have psychiatric social workers who will go and connect with the family. So there are a variety of persons who work as a team.
Mm, mm. So just as ma'am was mentioning, I'll add it to that
Yeah.
because like the different techniques, we were talking about cognitive behavior therapy or Freudian
Mm,
technique. This is like different modalities. When you go to a physical doctor, when you have something, you have a choice to go to a allopathic doctor, or you have a choice to go to a homeopathic doctor, or like in Singapore, you can go for TCM also, right?
oh,
So same,
yes,
yeah.
yes.
So we have these kind of modalities to use, and everything which a counselor or a psychologist is talking to you in that clinical therapeutic setting, it has a purpose. It's not a normal chit chat. It may sound to you as a normal chit chat when you are with a counselor, but everything has a purpose. It's intended, has a proper aim, and the person who is a therapist or a counselor or a psychologist, they know what they are doing, right?
Absolutely, absolutely right.
Yeah. So, moving forward, I want to talk about certain myths about mental
Mm,
health. There are a lot of myths associated with
oh,
mental health.
yes. Mental
Like,
health. Hmm. Yes, you were saying something? Like
yes,
what?
like the first one is like, oh, if I'm going to a mental health specialist, it means insane. Oh my God, shouldn't. Once you are there, it means something is wrong with you. Why don't you use your willpower? Come out of it. Resilience. Where is
Typical.
that?
That's typical, typical.
So, but
Change your thinking patterns. Yeah, you can come out of it.
the other day
So,
I was just talking to my friend, like, okay, we don't say that to a person who has just broken his arm. We say, we don't
yeah,
tell the person, hey, just get up. Why
absolutely.
you are doing that? And
Yeah.
if somebody is suffering from some disease, God forbid, we don't tell them, why don't you just snap out of it? But in terms of
Yeah.
mental health, we just want to brush it under the carpet.
Brush it
So
under the carpet. And there's denial, a lot of denial. No, 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 my child is okay. Nee, nee, my depression is not that much. I don't think I need, a, a lot of times, I have clients coming to me and telling me, ma'am, actually, I just thought I'll take one session with you. And actually, there's not no major problem. I'm fine. And then gradually, as we start talking, then things come out. Or my child is very smart, very brilliant. It's just that he cannot pay attention. or he just cannot concentrate on his studies, or we are having problems in our marriage, but it happens in every marriage. So,
Right.
but still I thought I'll give you one try. But then that is one myth, but a lot of stigma, because you don't want to be labeled as abnormal, as somebody who is not, who is a failure, who has
Mhm.
not been able to cope, who has kind of failed in one's marriage or failed in one's life or something like that. So usually people, even till now, unfortunately, at least in India, I don't know about Singapore, but there is a lot of stigma. People will say, I have students coming to me and saying, ma'am, please don't tell my parents.
Mm.
I don't want my parents to know. Like during the lockdown, there were so many young students who were staying at home, and, they were contacting me and telling me, I can't talk to you, ma'am, because I can only message you, only text message, because I don't want to be overheard. They may be having relationship problems or problems with the parents themselves, uh, some kind of sexual abuse or whatever. So they are not able to say. So there's that stigma. And they say our parents will not allow us to go to a counselor, things like that. So the stigma is something which is carrying on even today. And another myth that is there is that it can't happen to me. It can
Yeah.
happen to others, but I am all right. It can't happen to me. Then a lot of people think that it can't happen to children. It only affects adults.
Mm.
But
Mm.
there are even little children sometimes have trauma, have some kind of anxieties, fears. So at any age group, you can have it in old age also. You just can't say they are old, so it's okay. Let them feel depressed. So we have
Mm.
geriatric counseling also. At any,
Right.
we have career counseling, any type of area in life. Everybody can be helped. The other myth that I have come across, that people say, oh, but she doesn't look mentally ill. He doesn't look mentally ill. As if, you will look, as if you'll have a different look or a different behavior.
Mm.
Now,
Mm.
usually we do see some persons whose behavior, overt behavior is such that maybe their actions are a little different from us, or maybe their looks are a little different from us. But people with depression, they will not ever, they will look so normal to you that you can't even imagine that that person is going to perhaps going through so much of depression and is not wanting to live.
Mm.
The
Mm.
other myth that is that medicines, no, I can't take medicines, I can't, they are going to be addictive, I'll have to take them lifelong,
Mhm.
they'll have
Mhm.
side effects. So
Mhm.
very often I ask them, if you have high blood pressure, if you have diabetes, you have to take medicines for life. And then you have to weigh the pros and cons. How much of benefit will there be if you're spending the whole day in bed for 2 months? You're
Yeah.
not able to go to work. You're not able to do any housework. And just for as an example, it's better to consult a clinical psychologist, counselor who will refer you, because we refer to each other. So as I said, we work as a team, and perhaps a small pill will help you to get back to normalcy. So yes, every medicine will have side effects, but you have to weigh the pros and cons. So these are the other thing is, as we just talked, a lot of times they'll say, why should I go to a counselor or a psychotherapist? Why should I pay their fees for just 1 hour of talking?
Yeah.
I'd rather, I will do my child's counseling, or I will counsel my friend. What is the need to go to a counselor? But as we just discussed, it is not plain talking. That 1 hour, we know how every minute we are utilizing, how much of work we do before and after. We take down notes and, case histories and the interventions that we use. So it's all planned out. It's nothing is, advising or non-professional. And we have ethics.
Yeah.
So, yeah.
So it's not just confidentiality, there is positive regard, there is
Oh,
unconditional element here.
unconditional positive regard.
Yeah. So it's like we are not judging anyone, whoever comes for counseling, whoever comes for therapy, they can be rest assured that they are not being judged, and we keep
Not
a
at
positive,
all.
yeah, positive regard. That's part of the profession, and confidentiality also, right? And I was just thinking while you were talking about, like, they don't have a different look on their faces that we can read it from their face that, oh, this person is different.
Hmm.
Same for social anxiety, same for suicidal
Hmm.
tendencies. We see, oh my
Yes.
God, how can this person, commit suicide? And we are taken aback when someone commits suicide in our,
Hmm.
maybe the
Hmm.
people we know, and we're like, oh, this person
Hmm.
looks so chill, and how can this happen to him? So
Hmm.
we don't have any criteria on face which will tell us that, okay, this person
Absolutely.
having some issues or is going through a tough time and need professional help, right? So,
Absolutely.
Dr. Kishore, I would like to know, is it like plain we have this labeling which is keeping people scared and not coming to a
Hmm.
psychologist or a counselor, or is it a spectrum of the illness, like, or some issue, mental health issue? Like, I was thinking, like, if we have probably if we have fever, we know that it's a
Hmm.
spectrum, probably
Absolutely.
from 100 on or 99 on, the fever starts, and then it goes
Hmm.
beyond. So how about
Hmm.
mental health? Do we have a spectrum for
Hmm.
this? Or
Yes. Just before this, I was talking about classifications. We consider not just the severity of the symptom, we consider we have many axes on which we assess a client, many different axes. And how much it is affecting a person's life, what is the intensity of the symptom, what is the support system, what has been the history, the duration of the problem. So obviously, as you rightly said, if you have a low-grade fever, you perhaps will just try to regulate it at home with some other methods. But if it goes beyond control, if the person is not able to function in a proper way in his or her daily life and is showing distress, either crying a lot or just not able to go to work or anything, then it's better. And it's a continuum. It's not black and white. There are shades of gray in between. And
right.
for example, we have anxiety disorders. Now anxiety can manifest itself in so many ways.
Mm.
Anxiety can lead to a generalized anxiety disorder. It can lead to a phobia or a very immense fear. It can lead to obsessive compulsive behavior. It can lead to psychosomatic symptoms. Some
Mm.
people have asthma or digestive issues, irritable bowel syndrome, and all kinds of medical checkups find nothing wrong. But the reason is psychological. They're not faking it, but the
Mm.
reason is sometimes psychological. So we need to help and uh, help them to heal themselves. Basically, we are fellow travelers on the journey. So, as
True.
you rightly said, we are non judgmental. We do not criticize. We just accept. We give them a safe climate and we help them to help themselves.
True.
That is the
True.
main thing. And of course, sometimes when it is on the upper part of the spectrum, then we sometimes have to take psychiatric help and medicines.
So when we say about psychiatric help, it's medication. So we all
Hmm.
work as a team, counselors, psychologists, and psychiatrists. And wherever it goes beyond a spectrum, where is the day-to-day function is hampered, or probably the person is in very distressful state, then we go for the medication, so that the medication and therapy can work together hand in hand, and the person can feel relief, right? So
Yes.
I would like to talk about psychosomatic, because you just used the word. So for the benefit of
Hmm.
listeners, if you could explain what is psychosomatic kind of, problems or the issues which come up, because sometimes we keep on going to the doctor and say, hey, I'm feeling breathless, and all my tests show that I'm okay. So what is it? So I would like your,
Yeah,
insight
a
into
lot of clients, a lot of people, including children, in fact, I have been dealing with a lot of such cases where a person will have recurrent headaches, or stomach aches or asthmatic attacks, because, see, our mind and body is related. It goes beyond, I mean, there's no argument, but mind and body are related. If one is not physically healthy, you're bound to be feeling low mentally also, and vice versa. If one is feeling low, it affects our body. Now, I remember today, I'm going to tell you about my own case. When I was in high school, I got very severe stomach cramps. And those days in my childhood, which is many, many decades back, we used to have family doctors who would come and visit us. And this doctor with his bag, like you see in films, he comes and he says, it's psychological. And at that time, I was not studying psychology. So my final exams were about to come. So obviously I had anxiety, but at that time when the doctor said it's psychological, I was so angry. I said, next time, I hope this doctor gets this kind of a stomach ache. But later on, when I studied psychology, then I realized that poor doctor was not saying I'm faking it. Yes, I was highly anxious. I was a perfectionist and I wanted to get the first 2 ranks in my class. And, I was that kind. So the reason is psychological. So a lot of people, not only aches and pains, but sometimes people will lose their voice. Because if there is some public speaking event, suddenly the person will say, I can't speak. Sometimes you get a skin allergy, sometimes you'll get asthma, sometimes you'll get hearing loss. It can range. So these psychosomatic disorders, when all kinds of medical tests have been done, then they're referred to us. And that is when we go back to their childhood sometimes. Of course, we deal with the present symptoms, present life situation, but we also go to childhood experiences and anxiety patterns. And we try to identify what is the triggering anxiety or fear. And we try to help the person come to terms with it. And it works wonders.
So we work on what in past is linked to the present symptoms. We
Yes,
try
of
to figure
course.
out. It's like a curative approach. It's like it's not curious approach, sorry. And we probably like a detective. We try to find out, what in past is linked to present symptoms, and help them and being a catalyst in their healing. So it's actually not a suggestive therapy. It's not a directive therapy. We don't advise them. First of all, it's non-advisory. We don't do, counseling, psychotherapy. We don't give them the advice. We want the advice should come from within. So they have to take
Yes.
the responsibility of their lives. I keep saying one thing, that we may be expert in the process, but the client is expert in their life. Right?
Absolutely. In
So,
fact, we have this client-centered therapy techniques where I use it a lot, where we know that the client knows his or her lifestyle. Here, I want to also add another point, Navroop, that mental health, the definition of mental health differs from person to person, culture to culture. What is healthy? For example, we Indians, we will worship a stone, we'll put a garland on a cow, and we are considered normal. But if the same thing is done in the USA or somewhere, they'll probably, think that this person needs psychiatric care. So cultural differences, what kind of clothes you're wearing, what food you're eating, the way you conduct marriages, everything, all our rituals, all our customs, traditions, they define the sense what is normal and what is abnormal. So there is no absolute definition of normality. So it's the client who knows his or her cultural context. Also age. What is okay at 5 years may not be okay at 25 years. So age, gender sometimes, but a lot of, or for example, a historical timeline, chronological, environmental issues. For example, if there is a natural disaster, there's been a major earthquake, or there has been a terrorist attack, then people are going to behave differently. There is going to be panic. So we can't say, oh, so and so is doing this, so that person needs help. So we have to always look at the context in which the individual, and the individual himself or herself knows it best. How can I know what cultural background that person is coming from? What were the family rules? What was the done thing while growing up? So these things we have to consider.
So it's like a normal reaction to an abnormal situation, or abnormal reaction to a normal situation, right? So if
Absolutely.
it is a normal abnormal situation, like some traumatic incident or some
Yes.
traumatic event in life, and then there is normal reaction like grief, or like mourning, or probably feeling sad, that's a normal reaction to an abnormal situation. But if the
Mhm.
situation is normal and I'm reacting abnormally, then we need to figure out where the trigger point is, right?
And if it lasts for a longer time, not, a short temporary change in behavior due to illness, due to a bad mood, that's understandable. But if it persists, then one has to be careful.
Yeah, yeah. So we discussed some factors also determining mental health. Would you like to shed some more
Yeah,
light? Yeah,
yes.
yeah.
I would like to say that there are many things. It's not, a lot of times, people think that mental health goes haywire because the person is weak, because the person has not been positive, has let go, is not making efforts. No, sometimes it is also genetic factors.
Okay.
There are some issues like schizophrenia, depression runs in families. But more than genetics, it's the pattern of child rearing, childhood experiences, family patterns, family, sometimes, usually, when I do a lot of counseling with children and adolescents. And every time a child is brought to me, it goes without saying that there is something in the family. And very soon, one is able to make out. So, family background, then biological, psychological, biological factors. Sometimes something as trivial as anemia or a thyroid disorder can lead
Oh,
to changes in mood. So very often one has to request them to, get all kinds of medical tests done, because if you're anemic, you're feeling very exhausted and lazy and lethargic. If you have hypo or hypothyroidism, then there can be a problem. Hormonal disturbances during puberty, menopause, hormonal changes, I won't say disturbances, hormonal changes also can influence a person's behavior. Some people do become more irritable and kind of lonely or sad or whatever. Then it's also trauma, as we just discussed. Trauma can be natural disasters, can be unexpected calamities such as death, but it can also be some kind of abuse, either in the present or in the past. It could be physical abuse, it could be emotional abuse, sexual abuse. And sometimes at that time, the child does not have words. Child does not understand what is abuse, in fact. Or they think everybody goes through this. Like, I have a lot of youngsters, young girls, who tell me they have issues now. And then one is able to find out the roots in their childhood. So any kind of trauma that is happening can lead to, and also failures. If you failed as a student, if the teacher has been very nasty with you, has been partial, then sometimes, or there's been bullying at school for your looks. And when I talk of biological factors, also there are many factors like your height, your color, your weight. A person who is obese is made a butt of jokes. A person who is too short can be looked at with prejudice. And so these kind of things, and also prejudices and social biases, lots of things that we grow up with do leave an impact. So there are lots of factors, of course, historical factors such as people who grew up during the Great Depression, during World War I and II, and now we are making history, COVID-19. So
Yeah.
I'm sure our grandchildren will hear stories from us. And so, every situation, see, the individual is in a context. There's a systemic theory which
Right.
says that we are not functioning alone.
Mm.
We have our immediate family, our microsystem, then you have a macro system, parents' place of work, your place of work, occupational hazards, type of
Mm.
marriage, and then you have the cultural, socio-cultural issues. You have laws in the country,
Yeah.
what is allowed, and then there's the chrono system. You have during history, for example, there are lots of Indians, whose grandparents or parents were migrants from another country,
Mm-hmm.
and they have suffered that kind of historical trauma, and that has affected them, and in turn then their personalities, and therefore further generations also
Mm.
sometimes get affected. Of
Yeah.
course, there are all types of stories. It's not always bad. Here I want to tell you something, that traumatic events are not necessarily bad. They're sometimes they make us stronger. There's a very
Right.
interesting saying: a human being is like a tea bag. It's
Mm.
only when you put him or her in a
Hot water.
difficult situation, hot water, boiling water, that this true color and strength come out. So,
True.
we all think, I think most of us have come out of very difficult situations. They've been tough periods, but we emerge stronger. So
Mm.
that is the way you have to look at problems,
Mm.
rather than looking,
Ah.
rather than going into self-pity or negative thinking or pessimism. Be
Mm.
optimistic.
Mm. Mm. So, a victim or warrior. So, it's up to us. The story
Abs-
is up.
right.
So life is not like, always a bed of roses. Things happen, but how we are able to take it. But sometimes these factors, as you mentioned, genetic factors or
Yeah.
hereditary or trauma in the chrono, timelines, these all things also contribute. So, Dr. Kishore, you just mentioned the factors which contribute to our mental health. Are there any general guidelines for maintaining or enhancing mental health?
Yeah. That's a very important question, because we must always be able to advise, in the sense, give general guidelines, how we can maintain our mental health. And I also want to tell you that whenever we talk about mental health, we should not talk only in terms of mental illness and curative measures.
Yeah,
Prevention is better than cure. So
definitely.
let us be proactive.
Mm.
Let us take measures, just like for your physical health. Uh, you may be very perfectly healthy, physically healthy, but still you follow a certain healthy lifestyle. Uh, so similarly for mental health also, I can categorize the strategies into physical, emotional, psychological. So in physical, of course, if you lead a healthy physical lifestyle, you are likely to have better mental health also. If you are taking adequate nutrition, rest, exercise, and this everywhere the world over today, there's talk of yoga, and yoga means body and mind, the union of body and mind, because as we just said, body and mind are connected. So if we look after our bodies well, it's going to be very, very useful for our minds also. Then
Mhm.
another very important thing that we must look at and learn is stress management techniques.
Mhm. Very
Stress
important.
management, because every human being has stress, whether it's a child, whether it's an adult, anyone. We all have stressors in life, everyday stressors in life. So we have to learn to deal with them. And that is what counselors do. We teach stress management techniques. And I'll mention some of them here, which everybody can practice. One of them is deep breathing, deep abdominal breathing.
Mhm.
When you breathe in, and not just take it up to the chest, but to the abdomen.
Yeah.
And then when you breathe out, so abdominal breathing is known to be very, very therapeutic. All our yoga experts also talk about that, but our Western psychologists also lay emphasis on deep abdominal breathing. And if you couple it with positive affirmations that I'm breathing in oxygen and energy and good thoughts. And when I'm breathing out negative thoughts, toxicity, not just carbon dioxide, anger, everything. Then we have to also learn techniques of time management, anger management, because we need to organize our lives better. So those of us who are good at managing time, good at managing our emotions, we are kind of comparatively, we stay better as compared to those who lose it, you know, who are not able to control. So self-control is a very big attribute. And for that, we need to practice, just like you practice driving or you practice bicycling, you have to practice these techniques. And a lot of people have to practice positivity, positive thinking, optimism, and also in social. Okay, so this was emotional, and self-management and self-care. Very often we think it is selfish to look after yourself. I'm a mother, I have young kids. How can I devote time on myself? How can I go out for a movie or go out with my friends? But it's okay. So have realistic expectations from oneself. Those people who have very high expectations, obviously they never get met. Not only from oneself, but have lesser expectations from others also. Because whenever we have high expectations, there's bound to be disappointment. Then you have to make an effort to like yourself. A lot of people don't like themselves. They are only remembering their failures, their negative points, their weaknesses. But again, that is what we help them do during our counseling sessions. We help them to become aware of their strengths and not focus so much, you know, okay, work on your weaknesses, definitely, but learn to accept yourself, respect yourself. If you don't respect yourself, how can you expect others to do that for you? And be kind to yourself, give yourself praise, give yourself positive strokes. And socially also, there are some social techniques. It is very important to remain in touch. Now, all of us differ in how outgoing we are, but you may be in touch with a couple of people or with 20 people. It's irrelevant. Be in touch with people, share your emotions, your fears, your feelings with those who are close to you. At the same time, be a good listener. You can't be very selfish and only talk about your issues. One has to be as a good friend, you know, unfortunately, I have come across people, again, youngsters, because I have a lot of youngsters who are coming to me, that their parents just don't listen to them. And that is something even within families, we have to listen, give importance, give respect to even a child. So listening skills, and always, you know, for me, I think one very quick recipe for good mental health is help someone. Bring a smile on someone's face. And the day you do that, whatever you have given, you get much more in return. You get a sense of satisfaction, achievement, that you brought a smile to somebody's face. And what happens is the focus goes away from you. You stop thinking about yourself for a moment, your problems, and your mind is diverted. So it's, of course, it's good karma, but it helps you in the long run. You get a sense of satisfaction. And another thing that we can do as in our social groups and all, that we can also seek support groups. Right. There are support groups. Here I have not mentioned children who are, children or even adults who are intellectually challenged. As you know, my daughter works with such youth in Singapore, and they also need the parents. It's very hard for the parents or caregivers. Let's talk of adults. Caregivers of adults who have mental illness or physical illness. They go through a lot of stress themselves. So it's important to have support groups for them. And whenever we are trying to stay connected in the society, in the community, there's a sense of we, wellness, and wellness comes from we. And I will also tell you the role of spirituality.
Yeah, I was coming to that.
Spirituality, humor. If you can laugh about your own issue
It's a
and
huge
just,
risk.
it's a huge, crack in the, the rock. Spirituality, faith in, okay, I'm not talking about religion or any particular god or such, but have faith in the universe, the energy, whatever you may want to call it, god or whoever. So if you have spirituality, because spirituality will teach you how to do good deeds, and you have a sense of faith helps. Even in physical illness, faith helps.
Yeah.
And arts, hobbies. Today, I should have mentioned when I talked about helpers, today we have therapists, expressive arts therapists. You have dance therapists, dance and movement therapists, you have music therapists. But even if you don't go to them, if you're feeling worried or tense or anxious, just put on some music and dance. Just sing.
Yes. Yes.
And sometimes collective group singing, like we go to functions, we go to a temple or a church, collective singing, collective dancing is so therapeutic, but so is individual art, painting, sculpture. There's so many ways that we can, basically the term used here in expressive therapies is catharsis. That's a Freudian term, that whatever is bottled up inside you, instead of coming out in a negative form, it is channelized into a constructive form.
Yeah.
It
I think
really helps.
journaling can also help you out, when you have
Journaling, I was going to say that.
yeah. So if you're
Journaling, where you write your thoughts, you write your worries, and you try to find the pros and cons, and tell yourself, I sometimes give homework that write 5 affirmations about your life and yourself every day, positive affirmations.
yeah,
And
yeah,
that really brings a lot of hope, because to be mentally healthy, we have to be hopeful.
true.
We have to always have some amount of optimism. And but of course, the last guideline is that in case you are not, if it's still continuing, take professional help. And by professional help, I don't mean that you go only when your problem has increased manifold. Today we go to a gym, okay, you may be perfectly healthy and very wonderful body, but you still go to a gym, right, to maintain, to enhance. We go to beauty parlors to maintain and enhance. So we go to counselors and psychologists to enhance our own personalities, self-improvement, self-enhancement, and we can learn even better techniques, meditation. We can learn, these days, mindfulness is a very important concept, being able to be in the present moment
Yeah.
and learn how to enjoy the present moment. So go to a therapist, go to a counselor for making yourself even better. Why just wait for any illness to come?
Yeah. So maintaining mental health is like a skill, and like other skills, it can be learned, it can be developed, and the more we practice, the more better we get on it, right? So
I
the
would
more,
also like to, can I add something? Sorry, I interrupted you.
no, go ahead.
I found a very interesting quote. Mental health is not a destination, but it's a process. It's about how you are driving, not where you're reaching. So your lifestyle, your physical and mental lifestyles have to be healthy. That is the primary thing. So just enjoy every moment of your life, every up and every down. And it's okay to make mistakes. It's okay to feel low. It's okay not to be okay. But I'll bounce back. Have that faith in yourself.
So journey is as important as destination. Give yourself more discounts, give yourself more permissions. It's okay to feel sad. It's okay to be in this feeling for some time. But the thing is, how soon I bounce back and how well I bounce back. That's more important. And seek professional help whenever it goes beyond a point and you feel that it's becoming overwhelming and you're not able to handle it on your own. So we request these webinars are also an attempt in this series, that people get aware of it. And there's no shame and stigma in going to a mental health therapist. You are no way weak. Rather, it's a sign of courage that you want to take first step toward healing, towards your health and wholeness, right? So this is what we are coming from. This is the intention. I would urge all of you at this moment, in case you have any queries to ask Dr. Kishore, they can you can probably raise your hand. We can switch on the video for you, or if you want to put it in the chat, you can put it in the chat and I'll ask on your behalf to Dr. Kishore. And meanwhile, I would like to sum it up in the sense, whatever you discussed, Dr. Kishore, about maintaining, enhancing mental health. So there are somatic techniques which are like breathing, which we call pranayam in yoga. You can abdominal breathing, deep breathing. And in somatic, we have dance, we have dance, we have singing, as Dr. Kishore just mentioned. And nowadays, we are not going into the details actually right now, but it is scientifically proved. We have polyvagal theory. There is a vagus nerve which gets activated when you dance, when you sing, when you do drumming, or when you are exercising. All those positive hormones, neurotransmitters get released in your body, and you have that positive upbeat feeling. So that's one way, which is somatic. Factors all can be countered. Mental health is a skill which can be learned and acquired, and it can be built on. That was the physical part. And then we have the self-care part, which Dr. Kishore just mentioned, that we have to take care of yourself. Talk yourself out of emotions, out of it. And they are just like clouds, it comes, it goes. The sky is always there. The sky remains always there. So the things will happen, but the pain, the events will happen. Events are inevitable, but how long you suffer is up to you. And then we discussed about self-care, and then there's the need for community, communal resilience. Like as Dr. Kishore mentioned, like the more we get connected to others, but there's a caveat in that. You cannot fill the other person's cup when your cup is half full. You have to be overflowing, and that is possible only through when you take care of yourself, either through exercise, meditation, positive affirmations, talking good, and accepting yourself in every way. Accepting yourself. I may be down one day, but you can say, it's okay, I'm feeling bad today, but I accept myself. I tell my clients to make a tea record. I tell them, I'm not happy, I'm feeling guilty, I'm having regret, but I accept myself. The more you do it, Dr. Kishore, we say that the neurons that fire together, that they wire together. So
Yes.
the more we do that practice, there is neuroplasticity which is happening. And for each one of us, we acquire those skills. So I would like Dr. Kishore to know from you, looking forward, what is mental health for community? I would request all of you to switch off your videos, please, so we can have the split screen. Shwanjali ji, yeah. And looking forward, we want to know
Yes.
how mental health, can be developed among the community, and what is the road ahead, if you can give us some guidelines for that.
Okay. First of all, as you rightly said, that you first have to look after yourself. And just like when you go on a flight, you are told, the instructions given by the crew at the beginning are that if there is a drop in oxygen, you have to first put on your oxygen mask and then the other person. Even if it's a baby, first put on yours. It's the same here. You are responsible for your own mental health. You have to take care of that. Then comes the family, society, and of course the community. Keep in touch, stay connected is a very important message. Try not to withdraw, keep in touch. And especially this year, these days during the pandemic, I think physical distancing has taken its toll. But fortunately, the internet has been, online communication has risen, and it's wonderful to stay connected with each other. So just call up somebody who you think has been low, call up someone who is not well, and just give them, a positive stroke. That really helps. And share your concerns. Then on at every person's level, we must remove the stigma
Mm.
at an individual level as well as a collective level. We must not be judgmental. Oh, so you're seeing a therapist, oh, but do you really need it? So let's not be judgmental of people. Every person is fighting or battling his or her own battles. Let them be the deciding person, whatever they want to do. And just give unconditional positive regard, which we as therapists are trained to give. The other thing is that I would recommend that everybody in every social group, we have a list of resources available in your
Mm.
particular city, in your particular country. It's important to have a list of referrals, support groups, list of counselors, therapists, psychiatrists, school counselors, child counselors, family counselors. So if some kind of a list can be prepared and available to the general public, it would really help,
Mm.
because sometimes we don't know where to go. And also, at a collective level, I'm sure these days most governments are allotting enough budget to mental health. Communities are not just catering to physical issues, but also mental issues. So that is an upcoming very good move. So we must always join hands. And this pandemic, for example, we don't know for how long it's going to last. So our immediate goal should be to stay healthy physically and mentally this year and the coming years also. And
Mm.
not feel ashamed if uh, there is a problem or something. Just contact some professional,
Yeah. So
and we are
not just
there for you.
Thank you. So not just at individual level, society, as a collectively, we all have to learn, to overcome that hurdle of stigmatizing mental health, or feeling that there's a stigma attached to going and seeking mental help from mental health professional. So collectively, the society has to evolve also, and it starts with each one of us, you, me, everyone whoever is present here today. I'm thankful to each one of you who are present here and listening and taking a first step, at least being aware of what mental health is, busting the myths attached to mental health, and taking that first step, destigmatizing this. Because otherwise, if we don't come forward, people will hide themselves in their houses, in the closed doors, they'll cry, they'll shed tears, they will not come out. So there is a huge need that this should be destigmatized and people come forward. And nowadays, I see in Western countries, people come out, they share their stories openly. They say, oh, I have healed through depression. I was suicidal last year and now have overcome. And there are many, many, many success stories. And this is a science, this is medical science. It is evidence based. There is proper, research backed in this science. And we know as therapists, we know, where when to refer to psychiatrists, where medicinal help is provided, and when it is just counseling or psychotherapy. So just come out, ask for it, and the help is available, very much available. Dr. Kishore, I have few questions here, in my chat box,
Sure,
so I would
sure.
like to ask those questions.
Mm-hmm.
One question is like, how do you help a loved one who is in denial that he or she needs psychological help?
Mm. It's hard. It's very hard. But the first step would be, if you really care for your loved one, you come for counseling yourself. There is, Navroop, there's a beautiful serenity prayer which says, give me the courage to change the things I can change. Give me the tolerance to accept the things I cannot change, and give me wisdom to understand the difference between the two.
Right.
Now, suppose I have a loved one, it could be a spouse, it could be a child, could be a parent, does not want to come to the professional. And it happens very often in our profession, you know that. Then I ask the concerned person to come himself or herself, because that person is also suffering. That person is a caregiver, maybe, the recipient of the other person's issues, maybe anger, maybe violence, maybe depression, whatever. So if I'm able to help a person deal with that person, deal with the person who's facing the problem, at least I will be empowering this person. And with patience, with love, maybe at a later stage, we can persuade the other one to come and seek help. So you help yourself first. As we said, if you cannot bring the other person, yes, this is a very common phenomenon. People are in denial. Why should, especially in cases of marriage counseling.
Yeah.
I don't need help, you go. So a lot of times, this happens, even with children. These days I'm working with a family where their 14-year-old has gone into a shell. And I think it's the pandemic has gone into, just locked himself in his room and is not wanting to talk. Even if he talks, he's very rude. So he refuses to talk to me. He says, no, I don't want to talk to anyone. And the schools are closed, so he doesn't want to study further. So right now, I'm helping the parents in how to deal with him. Let's hope at a later stage he agrees to come with,
That's also a huge
we can
help.
hope,
Yeah,
future.
yeah,
Yes,
yeah.
yes.
So the
But we
caregivers,
cannot force.
yeah, yeah. So the counseling is basically, we don't force people to come. It helps only when people are ready to come and when they're ready to change. So it helps only in those cases where people are willing to change and seek help. You know? So
Yeah.
because we are not using medication here, this is psychotherapy. We are using research-based, evidence-based techniques. It's a talk therapy. And then we have next question. My brother is going through a divorce case and his 4-year-old is with the mother. We are tremendously concerned about the negative thoughts which the child is being fed with and facing daily. Any guidance for him, 4-year-old daughter? Any guidance for his
Okay.
4-year-old
Now, see,
daughter?
if I understand correctly,
Yeah.
this question is asked by the male, right?
Yes, I think
The
so.
male, right?
Yeah.
He says that the 4-year-old daughter is with the mother.
Yeah.
Now,
Yeah.
unfortunately, this person is not having full access to the daughter. But whenever he gets to meet that child, he must assure the child, number one, it's not your fault. A lot of times, when divorces happen, children get torn between their loyalties for both parents. They also, they get torn between loyalties. They get very scared. They're not able to verbalize. They get very, very scared. They think it's going to be the end of the world. And the third thing is that they feel it's my fault. It's my fault. If I was not there, this problem would not have happened. My mother would not have faced so many issues. So as a caring father, I think he should explain or talk to this 4-year-old in her language, whatever language he can use with the child, that it's okay, you'll be fine, don't worry, basically reassure, and try to make provisions for her financially and otherwise. Because if the child sees that my father is respecting my mother, then the child will also have respect for the father. Otherwise, it may turn into hatred. So yes, this is a difficult phase for children, very, very difficult. And both partners have to deal with it extremely cautiously,
Yeah. And very maturely, very
very
maturely.
maturely.
Yeah, because children have very very sensitive imprintable brain, and they take in a lot of things without even being able to articulate what they are going through in those moments. So thank you, Dr. Kishore, that was very helpful. Then there is one more. Do people living with the person who has some mental illness need counseling too, or they heal on their own? Yeah, I think you mentioned it. You need
They
reassurance.
need, no, it's okay. They do need help. In fact, when I was during my academic career, one of my students did a project, and there's a lot of research on stress levels in caregivers, caregivers of physically ill and mentally ill. They are
Yeah.
very much, the stress is too much, excessive. So two things can help. One is being part of a support group, and the other is taking professional help, counseling. It will really help, because you're a human being. Don't deny yourself the chance to feel overwhelmed, or you have a right to be overwhelmed. You have a right to be upset. You have a right to get annoyed, irritated, have self-pity. So it's always good to take help and
Don't be
support.
too hard on yourself, right?
Don't
It's
be too
okay.
hard on yourself.
Yeah, it's okay to
Hmm.
have those feelings. And
Hmm.
the next one is how to recognize mental health issues in primary school children or younger ones, especially non-verbal kids who are not very vocal at the moment. So maybe primary school children or young children.
Mhm. So these would be children between, okay, below the age of, say, 8, I think.
Yeah, probably,
Yeah.
yeah. Primary
Yeah.
school children, yes, yes.
Primary, yeah. So these children, or maybe 10, below 10,
Hmm.
children usually differ a lot in many things. They have their own uh, speed levels, their own rates of development, language development, emotional development, physical development can be very, very different in different children. So a lot of times, parents get very hassled. My child is not speaking. My child is still not walking. My child is still bedwetting. Uh, you must remember that you have to stay calm yourself. A very important thing which we psychologists try to tell parents, and in fact everybody, do not label. The minute you label your child as you are too naughty, or you are such a burden on me, or anything like that, or you're always very rude, the minute we label somebody, that person feels that I'm that, starts believing, and especially children, because their cognitive thinking logic has not yet developed. So it's imperative that parents stop labeling their children in a negative way. But if you look at science, then usually children bounce back. Usually children have phases. But in case you find there is something tremendously different, for example, um, whatever the milestones, normal milestones are of speaking or walking, that may be one issue. It could be anger tantrums. It could be hyperactivity. Autism is another problem that is coming in young children. So I would say the best thing to do if you are concerned is to either contact a psychologist, or you contact your general physician, your doctor. Because even medical doctors, they have papers in psychology, they understand. And if they feel that your child is behaving very differently from uh, his or her age group, the normative condition, then they will refer you to a child psychologist or a child specialist. But basically, be calm, don't get impatient, provide good examples with your own behavior. If you are going to be aggressive in front of the child is going to learn aggression from you. If you're spending too much time on technological devices like iPhone, on your phone or iPad or TV, the child is bound to do that. If you are a restless person and you're always shouting, your child will also learn that. So be good role models yourself. And if you still think that there's something, the child is extremely sad or extremely withdrawn, or very has crossed the milestones that, much, much beyond, then it's always better to consult a doctor and a psychologist.
Yeah, go for the psychological assessment and the professional.
Psychological assessment, professional assessment. Yes.
Yeah. Yeah. So we have one last question, and this is my 13-year-old daughter is very brilliant in studies. Give her 100%, but her results are not as they should be. So she tends to leave incomplete answers. What should I do when I talk to her? There is no answer from her side. Written practice at home is done. Her answers at home are complete, but somehow when she goes for exams, she's just not able to give 100%.
Now, it seems very clear that this child is studying very well. is studious, is intelligent, because at home she can perform. Now, if she's not able to perform during the examination, we call it evaluation anxiety. Sometimes
Mm.
there's so much pressure from parents and teachers. Sometimes there's a lot of competition amongst students themselves. Now, 13 years is beginning of teenage.
Yeah.
And this is the time when kids are really, for them, peer group becomes very important.
Mm.
And a little, only if they're, if they're not up to the mark, it leads to a tremendous sense of dejection. And sometimes they feel, I'm not going to do well. And out of that nervousness, maybe she leaves out some questions. So the best thing would be to help her to get rid of that anxiety. And if the parents can do it, wonderful. Otherwise, basically assure the child that we love you for what you are. And it's okay. Marks are not everything. We want you to be a happy all-rounder.
Mm.
Basically, as parents, we should emphasize that we want mentally healthy children. It's not necessary for them to get very high grades and marks and come first in class or something like that. It's okay. We love you anyways. So that examination anxiety has to be they must try to take that away. If they are not able to do it themselves, then they can take professional help, come to a counselor.
So, as parents, you can tell them, definitely, you can tell them that their worth is not dependent on their marks and you love them no matter what. So, it's perfectly fine, because this sense of perfectionism, I was thinking about, I was reading about inner critic. This is the voice we have internalized mostly of our caregivers and our parents while we were growing up. So, the inner critic is usually the parental voice. So, the perfectionism which a child is adopting, we have to lower it down, tone it down, regulate it, and just tell them that it's okay to be, to have whatever, whatever best you're doing, and we are with you in that. So again, one last question. I hope we can
Okay.
end after this. So this is, since you mentioned autism, so we have one query like, how parents and caretakers of special need children need to take care of their mental health. Is it of the children or is it of the caretakers? Can I have the clarification, please? Uh,
I
okay.
think, uh,
Yeah.
yes,
So I think
yes.
you addressed both the thing because
Okay,
I
I'll
haven't.
address both.
Yes. Thank you.
So is the question about autism or in general?
I think the question is about how parents and caretakers of special needs children
Special needs children.
need to take care of their mental health. So so their own. So the answer is their own. So the parents, how do they take care of their own mental health because they are
Okay.
taking care of the special needs child? Yeah.
uh, it's a real challenge to bring up a special needs child, and it needs a lot of patience and a lot of dedication, and uh, it depends on the amount of disability, or if the need is too much, or these days it depends on the kind of problem there is. So if it is intellectual disability, then it is extremely hard for the parents. These days, I think in every country, in every city, there are centers, there are daycare centers, and some schools also have, of course, we talk about inclusive education, but again, it depends on the intensity of the problem. Sometimes there are special schools for those children who have special needs. Uh, it could be in hearing, in speaking, it could be physical challenges, whatever kind of disability that there is. So special needs organizations are there, and they themselves need a lot of strength and patience. There are support groups. If they do not find any support group in their region, it's better to go to a professional helper, counselor, and take help from them, because it's a valid anxiety and pressure. And not to feel guilty. You haven't gone wrong, basically. Do not be harsh on yourself. It's not your mistake that your child is a special needs kid. But we have to enable the child to stand on his or her own feet, in the sense, not literally, but in terms of being able to be self-dependent, self-help skills, those are necessary for this. Obviously, the child may not be able to, some children do come up and they're able to be educated to higher degrees, higher education. But it depends, as I said, on the degree of disability. But the parent needs to take care of himself or herself and must take guidance from a counselor or from a support group.
Yeah. So I would like to add one more thing here. Like if mental health is important, not just for the parents of special need children, we all have to be, proactive in terms of mental health, but especially you, since the stressor is there and you have to be proactive in terms of your own mental health. And as Dr. Kishore mentioned that you can take support, you can take help from the support group because there are constantly people are sharing about their own, what are the challenges they are facing and how they are overcoming. That's a huge resource. If you cannot find it in physical terms in your locality or in your region, online on Facebook also you can look for support groups. Nowadays there are a lot of support groups because of pandemic and COVID also. Everybody is meeting online, so you can check for support groups online and then look out for helplines in your region or NGOs. If not, you can always go and seek professional help. You can go to a counselor, you can go to a psychologist, and these help are very easily available nowadays. So in that terms, we have to be proactive in taking care of our mental health. So with that, yes, we don't have any more questions in the chat window. So it was wonderful chatting with you, Dr. Kishore. Really helpful. We got insight into what is mental health, why it is important, why we need to destigmatize, and you helped us, bust those myths about mental health, factors, relating to mental health, contributing to mental health, resources contributing to mental health, and how we can take care of ourselves and be proactive in this approach. So we all have to, while we talk big things, while we say, think globally, we all have to act locally in our own individual capacity to work towards better mental health, not just for ourselves, but for the whole community, our families first, then for the community, and then for the country and the region and the whole world, make it a better place. And I would like to thank each one of you also, to coming here and sharing this precious time with us and listening to myself and Dr. Kishore. And if any one of you want to get in contact with Dr. Kishore, I would request Dr. Renu to please put your email ID on the chat box so that if anyone wants to contact you directly, they can contact you. And I'm placed in Singapore. If any one of you want to come or contact me online or offline, my number is available. I can put it in the chat box, or you can go and follow Heal with Nav. The logo is behind me. You can follow it on Instagram, and we have a Facebook page also. And the video for this webinar will be available on Heal with Nav Facebook page, and you can view it again and go through the whole concept one more time at your own convenience. Thank you so much for joining us, and we'll be bringing you one more episode very soon. We are thinking to start every Saturday. We'll be bringing one episode of Heal with Nav webinar, bringing one new topic about mental health, where we'll be discussing in detail. Today it was a broader view of mental health so that we have an understanding about mental health and the importance of mental health. Going forward, there'll be many more webinars, and I hope you all can join us. Thank you. Thank you, Dr.
Thank you
Kishore.
so much, Navroop, and all the best to Heal with Now. It's a fantastic initiative and very much needed in the world today.
Thank you.
Thank you.
Thank you for your time. Thank
I've
you.
written my
Bye.
number and my email in the chat
Yes,
box.
yes. Thank you. Thank you. So
Thank you,
everyone,
everyone.
yeah, it's renukishore@gmail.com, RENUKISHORE@gmail.com, and her mobile number is also there. It's 9810307100, and it's India number. And if any one of you is reaching out from Singapore, you can use WhatsApp or add prefix +91. Okay. Thank you. Thank
Thank
you.
you.
Bye-bye.
Thank you so much.